Hello everyone, my name is Sakina Fundi. I'm a senior at Anna Maria College in social worker major, and my professor for this course is Dr. Chang, and my presentation title is COVID-19 and mental health in college students. I'll start with social problem. College life is stressful because of transition between high school and college. Students go from living under the supervision of their parents to providing for themselves while also focusing on school, kind of double work, school, and taking care of themselves. The pandemic has raised the number of students with poor mental health. College and universities switched to online school because of the pandemic. This method of teaching was not successful in balancing out the students' mental health and their education, because sometimes in person people help each other, but this remotely you have to be by your own. If you don't have a nice team to help you, you can just be by you. That's why with this pandemic, students face a lot of the high level of mental health. Background. According to the Daily Free Press, the pandemic has negatively affected many students' mental health, causing some to experience medical problems and other disruptions. This illustration by Hannah Hoshinga, Daily Free Press staff. Research question and hypothesis. Question: how has COVID-19 affected the mental health of college students? And hypothesis: I believe that as COVID-19's impact growth, the mental health among people in general drops, and college students are among the victims. Why college students are among the victims is because um, they are not doing only school, but they are doing also work, providing for the family. Some college students like myself, we have a family. So to cope with the family, your life, and school work, that is not easy. So make college students be the victim of the pandemic, because the more people are affected with the pandemic, the more college students are victim of this pandemic. Research design. The study regarding this paper collected information from students who were attending large public universities. It used quantitative research since the response from the students were broken down into statistics to present the hypothesis that was proposed by the NCBI. Data. 71% of students increased stress and anxiety due to the virus. 86% of the students express worries regarding decreased social interaction and increased concern on academic performance. There is some people who learn well when they are in group, when they are like just alone. Some of them face a lot of problem and issue because they feel like it's not the life that they wanted to be in school. So for them, in person is what they want, but because of the pandemic, we were not allowed to be in person. And COVID-19 has negatively impacted 70% of participants, dietary partners. 59% expressed their concern about their financial situation being impacted by COVID-19. A lot of people are jobless. The unemployment keep raising every month, and the money that we receive from unemployment is not enough to cover all the needs that people have. 89% indicated difficulty in concentrating on academic work because of the pandemic and the worries. They don't know what tomorrow look like. 91% indicated that COVID-19 increased the level of fear and worry about their own health and the health of their loved one. We have no access to visit our grandparents because of the pandemic, because you don't know what is that visit can cost you, even though you love your people, but you can't visit them because of the pandemic. The sample the sample used in this study was collected by the National Center for Biotechnology Information, NSBI, which is under the National Institute of Health. The study was conducted at a large public university through an interview survey. In this slide, I have four more articles. I have research question, objective, hypothesis. I have also independent variable. I am not gonna say one by one because of time, but you can read and see what I have in this slide. The next slide have research design for all the four articles. I also have data on this same slide, and the next slide have sample for each article, and we also have data analysis. And this is the last slide of my presentation that have findings and limitation for all the four articles. Because of time, I didn't have chance to explain everything. But if you have any question, don't hesitate to ask or contact me. I'll be more than happy to answer your question. Thank you so much for listening for my presentation. My name again is Sakina. Thank you.